Shock is a life-threatening condition where the body's tissues and organs aren't getting enough blood flow, meaning they're starved of oxygen. This can lead to organ failure and, if untreated, death. So, understanding it is crucial. Shock begins with an initiating event, such as blood loss, heart failure, or infection, which reduces tissue perfusion. In response, the body enters a compensatory phase, activating the sympathetic nervous system, the renin-angiotensin-aldosterone system, RAAS, and releasing anti-diuretic hormone, ADH, to maintain blood flow. As perfusion decreases further, cellular hypoxia ensues, causing a shift to anaerobic metabolism, which leads to metabolic acidosis and cell dysfunction. The inflammatory cascade is triggered, releasing pro-inflammatory cytokines that damage the endothelium, resulting in capillary leakage and systemic inflammation. This worsens microcirculatory failure as abnormal clotting, vasodilation, and increased capillary permeability further impair organ perfusion. As tissues remain hypoxic, organ dysfunction sets in, eventually progressing to multi-organ dysfunction syndrome, MODS. Without timely intervention, shock reaches the refractory stage, becoming irreversible and leading to death. Let's talk about types of shock. First up, hypovolemic shock. This happens when there's a severe loss of blood or fluids, leading to inadequate circulation. Think trauma, major surgeries, or dehydration from vomiting or burns. Symptoms include a rapid heartbeat, low blood pressure, cool and clammy skin, and confusion. Treatment: fluid resuscitation, controlling bleeding and oxygen therapy. Next, cardiogenic shock. Here, the heart can't pump enough blood despite having enough volume. Causes: severe heart attacks, heart failure, or arrhythmias. Watch for chest pain, a rapid or weak pulse, shortness of breath, and cold extremities. Treat it with medications to boost heart function, mechanical support, or procedures like angioplasty. Now, distributive shock. This type involves blood vessels losing their tone, causing a severe drop in blood pressure. It includes septic shock from infections, anaphylactic shock from severe allergies, and neurogenic shock from nerve damage. Symptoms can be low blood pressure, warm skin, initially in septic shock, rapid pulse, and altered mental state. Treatment varies. Antibiotics for septic, epinephrine for anaphylactic, and fluids and vasopressors for neurogenic. Then there's obstructive shock. This occurs when blood flow is blocked, like in pulmonary embolism or cardiac tamponade. Symptoms are shortness of breath, chest pain, distended neck veins, and cyanosis. Treatment involves removing the obstruction, such as using thrombolytics for clots or draining fluid around the heart. Let's talk stages. The initial stage might be asymptomatic with mild symptoms. The compensatory stage shows rapid heart rate and cold, clammy skin. In the progressive stage, blood pressure drops and organ dysfunction starts. The refractory stage is often irreversible with multi-organ failure. General symptoms of shock include low blood pressure, rapid weak pulse, cold clammy skin, rapid breathing and confusion. Diagnosing shock involves checking vital signs, blood tests, imaging, and ECGs. Shock indices are crucial for assessing the severity of shock. The shock index, calculated as heart rate divided by systolic blood pressure, is normally 0.5 to 0.7. A value above 0.9 indicates higher mortality risk. The modified shock index, which uses mean arterial pressure, is more sensitive for early instability. Elevated lactate levels signal tissue hypoxia, while a base deficit below 5 mQl reflects severe metabolic acidosis. Lastly, rising PaCO2 suggests worsening ventilatory function. These indices guide shock management and treatment decisions. The key focus in managing shock is to restore adequate perfusion and oxygenation before the body reaches the irreversible stage. Treatment generally includes fluid resuscitation, oxygen therapy, medications, possible surgeries for trauma or obstructions, and mechanical support when necessary. So that's a quick rundown on shock and its types. Always remember, early recognition and treatment are key. In essence, shock is a critical condition that requires prompt diagnosis and treatment to prevent irreversible organ damage and death. The key to managing shock effectively is early recognition of symptoms, understanding the underlying cause, and providing targeted treatments such as fluids, medications, and surgical interventions. Stay sharp and keep learning.